How does posture reveal lung cancer respiratory distress? Imagine watching someone struggle to breathe and noticing how they sit or lean. Posture can tell us a lot about how well someone's lungs are functioning and whether they might be in respiratory distress. When the lungs aren't working properly, the body often responds with specific postural changes that can be seen during a physical exam. These changes are the body's way of trying to make breathing easier when the lungs are compromised. One of the most common signs is the tripod position. In this posture, a person leans forward slightly, resting their hands on their knees or a table. This position isn't usually deliberate but happens automatically when breathing becomes difficult. By leaning forward and bracing their arms, patients activate their accessory respiratory muscles, like the neck and chest muscles. This extra effort helps expand the chest and improves airflow, making breathing a little easier. It's a clear sign that the lungs are struggling to meet the body's oxygen needs. Another posture often seen in severe respiratory distress is sitting upright. Instead of reclining or lying down, patients tend to sit straight up. This position helps optimize lung expansion because gravity assists in opening the chest cavity. Sitting upright reduces the work of breathing and can be a subconscious attempt to improve oxygen intake when lung function is impaired. Postural changes aren't only temporary. After lung surgery, such as for lung cancer, patients may develop lasting postural alterations. Surgery can affect how the chest moves and how muscles work, leading to changes in posture. These alterations can also impact balance and gait, increasing the risk of falls, especially in older adults. Research shows that people after thoracic surgery often have impaired balance compared to healthy individuals, which highlights the importance of careful physical assessment. Chronic lung diseases can cause structural changes in the chest wall, further affecting posture. Conditions like kyphosis, which is an exaggerated forward bend of the spine, can limit chest expansion and worsen breathing difficulties. Structural abnormalities like pectus excavatum, which makes the chest look hollow, or pectus carinatum, where the chest protrudes outward, can also restrict lung capacity. A barrel chest, characterized by an overexpanded rib cage, is often seen in chronic obstructive pulmonary disease or severe asthma and indicates long-term lung issues. During a physical examination, healthcare providers pay close attention to how a patient holds themselves. Observing posture gives quick clues about respiratory health without any invasive tests. If a patient shows signs of leaning forward, sitting upright, or has chest wall deformities, these are important signs that their lungs may not be functioning well. These postural clues often come with other signs like rapid breathing, using neck or chest muscles to breathe, or bluish coloring of the fingertips, all pointing to significant breathing problems. Recognizing these postural signs is vital because they help doctors decide whether further testing is needed. They can guide the clinician to perform imaging studies or other diagnostic procedures to determine if lung cancer or other lung diseases are causing the breathing difficulty. Remember, each person's body responds differently, and these signs are part of a bigger picture that includes symptoms and medical history. Always consult healthcare professionals for a thorough assessment and personalized advice. Posture is a window into lung health, and paying attention to these signs can make a real difference in early detection and management of respiratory issues.